You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, it's called full mouth reconstruction. Patients that their mouths, their teeth and gums are in really bad condition. According to my first guest, he says you're never too far gone. Your teeth and gums are never too bad to not have the smile you've always wanted. With us, we have an expert on the topic, Dr. Sista. Dr. Sista, welcome to the program.
Thanks, Randy. Thanks for having me.
All right, good. Now, you brought a stack of photos. We'll try to get to as many of those as possible, but give us a working definition. Like, what is full mouth reconstruction?
Randy, so full mouth reconstruction can mean a lot of things, but for today's interview, we'll kind of narrow it down to basically mean that it's reconstructing or rebuilding a patient's mouth. Not everyone is ready to pull all their teeth out yet, so it's whatever we need to do to get their gums and tissue and teeth healthy so that they can get back to the life that they deserve.
So even if somebody has gum disease, the bleeding gums, bad breath, loose teeth, they can still, because you say losing teeth is expensive, that you could still maybe even save some teeth and give them a good smile. Do you see that a lot in your practice?
Absolutely. And every day we see it. And so, these patients come in and maybe they didn't know what options they had, or a lot of times they've avoided the dentist just because their preconceived notions about, I don't want to lose all my teeth. So what we do is we give them options for saving teeth and just getting healthy and getting a beautiful smile that they can be proud of.
Okay, good. Who's the typical full mouth reconstruction patient you see, if you had to categorize them?
Okay. Well, it really could be anyone, Randy, but I'll give you a few examples.
Okay.
In some cases, it could be the person who was told that their only option is dentures, and their mom and dad had dentures, so they're just headed down this road for, I just know at some point I'm going to have dentures. So I had one patient came in and he was in so much pain and was just tired of his teeth and thought his only option was dentures. And I literally had to talk him out of pulling all his teeth. And I said, we're not at that point yet. We can save a lot of your teeth. Okay. But we can get things cleaned up. We can get rid of the infection, get you healthy, get it to where you can chew again. And with the combination of treatments, implants, some crown and bridge, and getting him clean and healthy, he loves his smile now. And now he's looking forward to doing more treatment, doing more cosmetic things like veneers and such, because he's comfortable. He's happy with the smile now. So another category that we see is, your typical patient that hasn't been in the office for, believe it or not, 15 or 20 years.
And not been to a dentist in 15 years?
Not at all. And the reason is, and I see this every day, Randy, it's actually pretty terrible, but they had such a bad experience when they were young. And that pain or that painful memory has kept them away to the point where they neglect their teeth. And again, not having been to a dentist in 10 to 15 years, they think that, oh, you know what, I just have to get all my teeth pulled. And it's simply not the case.
Really?
We can do a lot of things to get people to where they have a full, beautiful, healthy smile, but still save teeth, and combination of treatment of implants and veneers. We can get them the beautiful smile, but not dentures.
You're big on IV sedation.
Absolutely. For me, it's the only way to practice. When we're doing these bigger, complex treatments, as it is, nobody likes coming to the dentist. I hear it all the time.
Do they say to you, no offense, doc?
Every day.
Do you have a funny one-liner after all these years?
Well, I tell them, you're not going to hurt my feelings. I don't want to be here either. But, we're here, good. And, let's do the best we can to get you taken care of. So with IV sedation, we're able to get patients the treatment that they need and do it in a way where they're comfortable. They don't remember the procedure. They go to sleep, and they
remember very little of the procedure.
They remember very little, and time just seems to go by. So even if it's a 3 or 4 hour procedure, for them it might be like 30 minutes, and it really allows them to come in and get the treatment that they need, but in a comfortable fashion to where they can get through it, we can get through it, and everyone's happy.
Now, what about safety? How does it stack up?
So
with sedation, we're talking about.
Well, depending on the case, sometimes we do general anesthesia and sometimes we do moderate sedation. But in all cases, our patients are safer because we're able to manage, through anesthesia and IV, their health. We're monitoring them, and so they never get to the point.
Blood pressure?
Blood pressure, oxygen levels. They're getting supplemental oxygen. And the medications that we give them actually can help lower their blood pressure or keep them at a state where they're just comfortable. They're not stressing their body like they would otherwise because they're not tensed up.
When you say you could do 6 months worth of dental visits in one visit, what does that mean? because of sedation?
So a lot of times, we're limited based on what the patient can tolerate. And so, they can only be in the chair for so long and they can only take so much treatment. So in cases like that, we have to appoint them multiple times to come back just to finish something. With IV sedation, we can do more in a single visit because we've taken that aspect out of it. The patient's not stressed, they're not tense, they're not sitting there in the chair worried about how much longer am I going to be here. And so we can finish treatment faster. So, as an example, in some cases, I can do implants and crowns, something that may take 4 to 5 hours because we're working on both sides of the mouth and multiple areas. And that patient without sedation would probably have to come a few visits. But with sedation, we can get everything taken care of in one visit, and then they're out the door in a few hours, but they don't have to come back for it. So with sedation, because we can reduce the number of visits, I've got kids, taking time off work is difficult to have to go back multiple times. And
you have 3 kids.
I've got 3 kids.
3 little dentists.
Yeah,
I'm
hopefully.
joking.
But, or to have to get permission from your boss to go to the dentist 5 or 6 times to get one tooth taken care of, so it's tough. And again, with IV sedation, we can just do more in one visit. Patients happier, less stressful, and they can get the work that they need in and out and be done in 1 to 2 visits.